Yes, Doktora, with all due respect po, kasi po, these are the process and thank you for that. Pero siguro ilang points lang po na para masagot yung kay Doktora Dalmacion because she made a study on your paper on PSMID. Ang binanggit po niya, and if pwede yung masagot, number one, it was hastily released, that the Lopez Medina is a poor study, that meta-analysis is in fact superior than the study that you have conducted. She also mentioned the credentials of Lori vis-a-vis, relatively to the ones that conducted the studies. The numbers of studies retrieved, kinabi po niya dito na sa atin daw pong study, walang preventive on the moderate and mild. Wala din po. Severe lang po yung ginawa natin study. And then on the base of that, nakita niya yung 76 reduction on death and 92% sa high dose. At binanggit din po niya dito yung WHO, kiniticize niya yung parang pagpapalit ng formulation for the meta-analysis studies. Baka po yun ang pwedeng masagot ninyo para lang ho klaro.
Mr. Chair,
Yes, GS Marcoleta.
with all due respect to Kong Mike Defensor, Mr. Chair, I think we should now proceed to the questioning because we can.
Is that a motion?
They can answer.
I withdraw my
Are
proposal.
you proposing a motion or is a normal request?
I move, Mr. Chair, that we proceed with the questioning already because all these explanations are nothing to us. We need to ask them questions on the basis of what they are presenting to us.
Mr. Chair, I withdraw my...
There's a pending motion.
Yes, Mr. Chair, I
Is there a
withdraw.
second? Is there a second?
Mr. Chair, if I may.
Congressman Mike, we need to settle first the motion,
Yeah.
then we can come back to you.
No, Mr. Chair, just to, because that was on the presentation, I wanted the points to be raised, but I withdraw my suggestion, Mr. Chair, and go through with the motion.
Okay, thank
Mr.
you.
Chair, sorry,
Yes.
if I may, for this, Marcoleta, may mga magpa-present pa kasi so that you can ask more questions. But of course, I defer to you if you don't want them to present anymore. Para lang you have also sana basis of questions to the resource persons. But they are here. But it's up to the pleasure of this Deputy Speaker Marcoleta if he doesn't want to listen to the other presenters anymore. Mr. Chair.
Actually, he has been texting me for 1 hour already. I'd say that he is already decided.
Mr. Chair, if I may lang po.
Yes,
Kung
Congressman
may,
Mike.
yes, kung may magpe-present pa pala po, kasi sa records ng Congress po to, if I may request our good Deputy Speaker, Congressman Marcoleta, baka po pwede ilagay lang natin sa record para lang, kung meron pa ho, kasi kala ko wala na, that's why I was withdrawing because they were not answering the points raised by the Dr. Dalmacion, which are very critical points. Pero kung meron pa ho magpe-present, baka po, for the record na lang po para mailagay sa record ng Committee on Good Government. Thank you, Mr. Chair.
There is a motion duly seconded. We on the motion is to stop the questioning and proceed to stop the presentation and proceed to the interpellation. So,
Mr. Chair,
any objection?
Mr. Chair, can we hear from Deputy Speaker Marcoleta? Baka naman magbagong isip ni Deputy Speaker Marcoleta or maybe to, pwede rin let's hear first from Deputy Speaker Marcoleta.
Deputy Speaker, you have the pending motion. Do you want to pursue your pending motion?
I will just modify my motion. I will accept their position papers or memoranda they will submit to the committee, and then we shall now proceed to questioning.
Is there a second?
Second, Mr. Chair.
Hearing no objection, the motion is approved. All resource persons, namely Dr. Eliza Quino, Dr. Rafael Castillo, Attorney Lorna Frances Filipino, and Dr. Benigno Agbayani are hereby requested to submit to the committee their position papers on the matter and that any corresponding presentations on this matter.
Mr. Chair, may we also request Dr. Alejandria also to submit their position paper para on record.
Dr. Alejandria and Dr. Dalmacion, can we receive copies of your presentation to be submitted to the committee? Thank you po.
Yes, Mr. Chair, I believe that supposed to be Dr. Alan Landrito also was supposed to present that. Let us also put on record and ask his presentation na lang po to be put on record. Thank you.
Dr. Landrito, if you are present or any of his representatives may request that you submit a copy of your presentation or position paper. Thank you. Next on the agenda is interpellation of the resource persons by members. First to interpellate is Deputy Speaker Bernadette Herrera.
Thank you.
DSBH, you have the floor.
Thank you, Mr. Chair. Yung unang tanong ko po is of course addressed to FDA with regards to the ano na po ang position nila with regards dun sa pag-follow sa national guidelines versus the ASEAN, because this would really help a lot in declogging yung pila ng lahat ng pending applications with the FDA. So may I hear from FDA with regards to this matter, Mr. Chair?
Yes, may we request the representative of the FDA, the Deputy Director General.
Apo. Good afternoon po, Honorable Chair. May I call on the Director of the CDRR po to report on the FDA position paper on the ACTD and the National Guide. Thank you po. Si Director Joyce Sirunay po.
Director Joyce Sirunay.
Thank you, Honorable Chair, and thank you, Honorable Congressman Herrera D. For the 1997 National Guidelines and the 2016 ASEAN Common Technical Documents, ASEAN Common Technical Requirements, we have prepared a presentation, but with the motion given earlier, we are going to provide the honorable committee of this presentation and the position paper. For the 1997 national guidelines, this is on the basis that there was already a signed document, because this is for the 1997 and the ASEAN Common Technical Document requirements. The ASEAN Common Technical Document is based on a commitment of the Philippines to the Association of Southeast Asia Nation. There are documents to it that we can share to the Honorable Chair that form basis for the implementation. In jest, the 1997 National Guidelines is a loose guidelines compared to the ASEAN Common Technical Document, ASEAN Common Technical Requirements. One is this: the Philippines is one of the three countries that are producing pharma products. If we're going to return to the 1997 National Guidelines, then the products that are coming from the Philippines is no longer compliant to the ASEAN Common Technical Documents, ASEAN Common Technical Requirements, which is at the ASEAN level. Second, it will form a technical barrier to trade because there is already an agreement within the ASEAN member state on these requirements. However, during the times of the pandemic, the Food and Drug Administration, through our principal, DG Domingo, has been issuing facilitated registrations and pathways that will allow products that are used for the management of COVID to be expedited. One of which is the Certificate of Product Registration for IVERMECTIN. So for the return to the 1997 National Guidelines versus the 2016 ASEAN Common Technical Documents, the position of FDA, as approved by our Director General, is to retain the ASEAN Common Technical Documents, ASEAN Common Technical Requirements, but facilitate the COVID-related applications that will allow availability of these products, but on a different pathway, not through the national, the 1997 national guidelines requirements for the registration of products.
Mr. Chair, with all due respect to
Yes.
Dr. Sirunay, Mr. Chair, through you, ma'am, hindi ko naman po sinasabing bumalik tayo, but I'm just saying we pause first with regards to this one. Kasi pandemya po tayo ngayon. We are in a pandemic. Kailangan po natin ng masusunod po natin yung para po sa ating sariling bansa. We have to support also, syempre, our manufacturers here in the Philippines. Kaya ang sinasabi natin, let's pause for that. It's a commitment, yes, pero syempre hindi naman natin uunahin ng diplomasya bago ang kapakanan ng ating mamamayang Pilipino. At ang isa pa po, pag mag-export po siguro ang ating mga kumpanya, then they follow the ASEAN. Pero syempre kung dito naman dahil nga may commitment po tayo with other member states. Pero kung matagal na po nating napapakinabangan yung national guidelines, naniniwala ko it's more than enough para gamitin natin, especially in this time of pandemic. Ako sana po, I appeal that you look into it. Kung hindi man, paano nyo po mapapabilis ang proseso sa ating mga applications ngayon, especially for COVID-related, because it's still not yet that fast. Can you give us that commitment na kaya nyong pabilisin yan?
Thank you very much, Mr. Chair. Can I respond?
Yes, we may proceed, Director.
Thank you very much, Mr. Chair, and Honorable Chair, and thank you very much, Honorable Herrera D. Yes, ma'am, we have facilitated the fastest of which was the EUAs, and we have COVID-related products that are being issued a certificate of product registration, and for COVID-related preparations under the compassionate special permit, it's 24 hours because we facilitate it by making it first to be online. Anything that is COVID-related, our principal, DG Domingo, has been facilitating everything so that the products will be made use by the management, by our frontliners in the management of COVID. Rest assured, ma'am, we are facilitating it, including we are, one more, can I, the drug emergency use is not being revised, and we are putting the drug shortages. So we are revisiting it as well, so that it will be more responsive to the need of our fellow Filipinos that are now stricken with COVID, and for the management of COVID by our frontliners. Thank you.
Mr. Chair.
Yes, TS.
Yes, Madam, pwede ko bang malaman kung ano yung mga bagong drugs na nilagay nyo under DEU, and is there a possibility that ivermectin can be put on this list? And then Laronlimab or yung others na COVID-related na mga bago na nakikita natin?
Honorable Chair, can I?
Yes, please proceed.
Thank you.
Director.
Thank you, Honorable Chair. Honorable Congressman Herrera D. It is baricitamib, dexamethasone, and tocilizumab. Those are the ones with under drug for emergency use at the moment.
To you, Mr. Chair, bakit po hindi na-approve as EUA? May nag-apply po ng EUA, yung Kioma. I think yung Kioma group applied for EUA for, bakit po sila na-disapprove?
Please answer, Director.
Thank you very much, Honorable Chair. For the application under doc tracking number 2021-40514416, the application on emergency use authorization, the documents being provided were for COVID treatment The EUA application was for COVID treatment, but the documents provided were inconsistent with the materials that they have provided. So they are saying that their EUA application. So I will just read so that I will not have a misquotation. No EUA approval for any of the listed NRAs eligible for reliance. No English translation and no actual approval on the application from another country. And then the indication applied for is EUA is inconsistent with the labeling materials, which is as an anti-helminthic.
So parang sinasabi niyo, ma'am, through you, Mr. Chair, pagka, kunwari, in the case of ivermectin, if it's going to be applied for COVID, kaya hindi siya mailalagay as EUA because you don't agree with that one?
For the application for EUA, which is for the management of COVID per FC 2020-036, they have to have proof, clinical trial phase 3 interim to trigger the EUA.
Mr. Chair, through you, tanong ko lang si Dr. Jody, wala pa ba tayong clinical trial phase 3?
Dr. Jody, please reply.
Sorry, sir. Kung tinatanong nila clinical trial locally, I think there's an ongoing trial in PGH. Pero kung naghahanap sila ng trials abroad, madami na at meron na pong meta-analysis. Ang problem po, meron declaration ng DOH accepting the systematic review. So magiging mahirap sa another agency in DOH na tanggapin yung evidence na yon. Kasi nagsabi na po yung DOH mismo na according to the systematic review, the ivermectin does not have sufficient evidence. Actually, Mr. Chair, that goes back to my question. Sino bang nagde-decide kung anong titig ng foreign clinical trial? Is it the CPG? I don't know who's going to answer this one. Maybe DOH can answer, any representative. Who decides kung paano po bang treatment natin sa clinical trials? Kasi yung mga EUA, lahat ng vaccines, walang local clinical trials yan all based on foreign clinical trials, and yet everything is accessible here nandito sa ating bansa. So who decides anong foreign clinical trials ang titignan?
Let's recognize Dr. Melissa Guerrero of the Pharmaceutical Division of DOH.
Yes, Mr. Chair, thank you for the question po. As explained now by Dr. Marisa Alejandria, ever since the start of the pandemic, we have been relying on the help of experts to help us sweep the evidence. So ideally po, nasi-sweep lahat talaga ng randomized controlled trials. Again, the Department of Health recognizes that the evidence is evolving. So ngayon, ang nakalagay po dun sa kanilang living CPG, insufficient evidence. It doesn't mean na wala talaga siyang evidence. It's just that now, insufficient evidence. But we welcome po ito po mga comments po ni Dr. Dalmasión, and we can submit the comments of Dr. Dalmasión on the review of the living CPG. We are now conducting a clinical trial locally together with the Department of Science and Technology po, again with UPPGH for mild to moderate COVID-19.
Yeah, Mr. Chair, nalala ko humingi si Dr. Guerrero ng copy ng presentation ni Dr. Iggy. Was this even considered at all nung sinadmit po sa inyo?
Dr. Melissa, please respond.
Sir, wala pa pong sinasubmit sa aming presentation. So you can submit that to us and then we can work that out with the living CPG kung ito po ay pwedeng i-consider dun sa kanilang review.
Who decides the membership of the living CPG?
Meron po kasing proseso yan, hindi lang po natapos kanina. So meron po silang COI management. I think they're working with other specialty societies and experts on evidence review. And then minsan po may mga DOH representatives po doon na umuupo din just so to make sure po na fit doon sa aming policy needs yung pong kanilang review.
Who decides nga, Mr. Chair? Who decides who
Meron
becomes
pong
a member of the
Meron pong
CPG?
steering committee po. Merong steering committee po.
Who are the members of the steering committee, Mr. Chair?
Can I refer to the living CPG po?
Dr. Alejandria.
Hello, may we request member of the CBG, Dr.
Alejandria.
Alendria, to answer.
For the steering committee, we have members from the Philippine College of Physicians, Philippine College of Chest Physicians, Philippine Academy of Family Physicians, Philippine Medical Association, the Department of Health, Philippine College of Emergency Medicine. So it's actually 20 stakeholder groups that are involved. So 20 societies who are actively involved in the management of COVID-19. So representatives from each of these societies.
It was mentioned earlier that nag-declare kayo ng conflicts of interest individually. Pero paano yung associations? Kasi syempre as an association, katulad ng pinakita ni Kong Mike Defensor before, you're reliant also on certain pharmaceutical industries for sponsorships and all that. How do you manage that one?
The process is based on individual conflicts of interest. We assess because it's the individuals who participate in the consensus panel, in the voting, in the deliberation of the recommendations. It's the individuals. And these individuals are designated by their respective societies. So the evaluation of conflicts of interest is on an individual basis.
Ano pong magiging role ng PSMID ngayon? Paano ang setup nyo? PSMID and Living CPG? Is PSMID part already? Kasi dati PSMID lang eh. Tapos nung nag-complain kami, naging Living CPG na. So ano po ang involvement ng PSMID?
May I clarify? It was only during the first quarter of the pandemic that it was PSMID who volunteered because we are in the front lines. We needed to give immediate guidance to our practitioners. So during the first quarter, we came up with an interim guidance. And then succeedingly, but that interim guidance is not based solely on our infectious disease practitioners. We also consulted the pulmonologists, the internist in coming up with the guideline, the Infection Control Society. So it's not a unilateral decision by the society. So from the start, it has been always a collegial consultation among the societies who are managing COVID-19. And we have expanded this in the COVID Living CPG to include also other societies like Academy of Family Physicians, as we know more about the disease in that it involves different specialty societies. We have involved everyone already. So because the management is holistic.
Mr. Chair, since andito na si Dr. Alejandria, may I ask her in connection with the presentation of Dr. Dalmasión, hindi po ba natin i-consider yung mga meta-analysis? Bakit po yung systematic review pa rin po tayo nag-concentrate?
We actually updated our systematic review. The March data includes only 6, and then we updated that in April, and this May we also updated it. We have now 18 RCTs, and we can show you the meta-analysis that we have if you want.
May we hear from Dr. Dalmasión? Dr. Dalmasión.
Dr. Dalmasión.
Chair, what's the question?
Yung sinasabi po niya na
No, a recommendation was done from a systematic review. You don't make recommendation if you're saying there's insufficient evidence. Because at the time that the systematic review was released by PSMID, there was also existing meta-analysis about 2.
Dr. Alejandria, through you, Mr. Chair.
Dr. Alendria,
Yeah.
please respond.
We acknowledge that there are existing systematic reviews, and we have updated our evidence summaries. That is the concept of a living CPG. We update as the evidence evolves, and we have updated our evidence review such that now the recommendation is there is insufficient evidence to use ivermectin for mild to moderate COVID-19 except in the context of a clinical trial. And then we suggest against the use of ivermectin in severe and critical based on the review of the evidence. We have
Mr.
seen
Chair,
in our
yeah.
meta-analysis.
So how do you decide kung ano pong titig ng meta-analysis? Kasi may meta-analysis that's also saying ivermectin is safe to use, na pwede siyang gamitin for mild to moderate.
Maybe Dr. Lance, you would like to... Oh, okay. So how... What we ask... Okay.
Can I add? I'm asking permission to add.
Yes, you may proceed, Dr. Dance.
Yes, good afternoon. I'm Dr. Dance from the Living CPG as well. There are several criteria before you actually, we make a protocol per question. So we already have 120 recommendations from all the systematic reviews that we have done. Specifically for ivermectin, the comparison that were made by Dr. Dalmasión was already the previous systematic reviews and meta-analysis that we have done. Since this is a living CPG, we update this almost on every 2 weeks, every 3 weeks. We update it as soon as the new randomized controlled trials are coming out. So yung comparison that was made was already an old basis for the recommendation. So we have new updates on this already. So with regards to the question, what criteria do we use to include or exclude certain studies? Very strict, ma'am, yun, no? So randomized controlled trials, depending on the research question per individual trials, those are the ones that has to be included. Some of those included in the previous meta-analysis, and we look at all the meta-analysis that has been published, what we saw were some of the studies that were included were just PowerPoint presentations. They're not really published nor preprints of these trials. So we appraise each of the individual studies that has to be included. We appraise the quality of evidence. We just don't include all available studies. So if they say they saw 200, they saw 300, we actually saw most of them, but all of them, but we had to choose based on that's how a scientific paper is actually, or a systematic review is done, is you have a very strict eligibility criteria, and those that will satisfy those criteria has to be included. Now, in situations where there are very few studies, sometimes we might have to lower the quality that is accepted, no? But we have to address the limitations found on those studies. But in this case, in ivermectin, we already have, as of our last systematic review and literature search, we already have included 18 randomized controlled trial. So hindi talaga wala, no? Meron talaga, ma'am. Kaya lang, unfortunately, most of these trials are already done in the early stages of the pandemic, and some of them were done in a rush and really was not very good clinical trials. In systematic reviews, one of the things that we have to make sure of, because this is like garbage in and garbage out, so you have to make sure that you only include quality studies so that your conclusions can also be good conclusions and not be biased, no? So ganun, ma'am, yung systematic review with regards assessment. So super, ano naman po, ma'am, yan, maraming supervision. It has gone through several evaluations from other methodologies as well. Yan.
Mr. Chair,
Yes.
to follow up, doon po ba sa 18 na binase nyo, meron po ba doon in favor of ivermectin? Na may positive na doon sa 18 na tinignan ninyo?
Meron po. Meron po, Congressman. And actually, yung overall total niya is actually nasa positive side. Pero in the last few weeks, with the additional newer studies, with regards impact on mortality, parang mas lumalapit na siya doon sa results that says, andito na yun, pakita ni Doktora. that says it's almost as good as placebo. But we're still waiting kasi there are around 40 randomized controlled trials ongoing and recruiting. So we're waiting for those results, including yung one that's going to be started here in the Philippines as well. So we're waiting for this kasi sino ba ma'am yung ayaw ng merong treatment sana tayo for COVID, no? Lalo na kung oral lang, and then yun. Sige,
Sir
Isa.
Chair, ma'am, correct me if I'm wrong, di ba parang sa remdesivir, ganun din naman yung ano natin, that insufficient evidence din po siya? Tama po ba? At saka hindi na po siya ina-allow ng WHO.
So ano, Isay, would you like to answer that or ako na?
Okay, sige. For remdesivir, first is remdesivir is for hospitalized patients, and there are 4 big RCTs that have been conducted. All the trials did not show benefit in terms of mortality, but there were trials that showed benefit in terms of clinical improvement. So it reduces hospital stay. So the recommendation actually for remdesivir is actually a conditional recommendation. It is not recommended for patients who do not require oxygen. It is also not recommended for patients who are already on mechanical ventilation. It is only recommended for a small subset of patients who are requiring low flow oxygen. So these are those who are on the severe but not critical phase. So that is only the subset of patients where it is suggested actually to be used. And the recommendation is just a suggestion, not a strong recommendation, because we are also waiting for the final results of the WHO Solidarity Trial, which has stopped its recruitment last January, and it is the biggest trial so far. So we are awaiting the results of that big trial, and then before we can make any conclusive recommendation as far as remdesivir is concerned.
So, Mr. Chair, yun doon nga ako nagtataka eh. Parang pareho siya ng level ng ivermectin, pero sa ivermectin, lahat man ng societies nagsabi, bawal yung reseta yan, bawal yung puro bawal. Pero sa remdesivir, sabi mo nga, hindi pa sigurado, conditional, tsaka ano, pero all hospitals are actually using it, and no society is talking or saying na caution on the use of remdesivir. I would like to know, ano po bang difference nung dalawa na bakit sa ivermectin, takot talagang gung-ho na lahat ng societies, bawal kayong magreseta niyan, bawal kayong gumamit niyan. Pero sa remdesivir na medyo marami na rin nagkakaroon ng evidence against it, wala pong nagsasalita. Bakit po ba ngayon? I would really like to understand, ma'am.
First is remdesivir, it has to be used in addition to dexamethasone. We're not saying that we use it alone. So in hospitalized, because it's steroids that has been shown to reduce mortality among patients requiring oxygen. So remdesivir, tocilizumab, these are recommended to be used in addition to steroids, not by itself. Okay, so that's for hospitalized patients. For ivermectin in mild to moderate, we are not saying that physicians should not. We did not say. What we said was there is insufficient evidence. When there is insufficient evidence, we call it clinical equipoise. Now, we are not sure, there is much uncertainty. So you can prescribe, but you need to explain to the patient that there is still uncertainty as far as this, as far as ivermectin is concerned. That's very similar to how we started out with hydroxychloroquine in the initial months of the pandemic. It was also insufficient evidence. We had to explain to the patient.
Thank you, Mr. Chair. Yun nga po, kasi yung members ng living CPGs are also those societies that released those statements that you cannot prescribe or matatanggalan ka ng lisensya pag nag-prescribe ka ng ivermectin. I'm happy that you're stating now that doctors can prescribe it. Pero syempre, when all the societies na members din ng Living CPG release a statement, then it causes confusion to a lot. Sa study niyo po ba, ganun po ba kalala ang side effect ng ivermectin na kaya kailangan i-warning niyo lahat ng doktor na walang magreseta nito? I mean, you're also a member of those organizations that's part of PSMID. I would like to know, ano po bang nakita niyo na malalang side effect nito na talagang para siyang bawal na droga na bawal inumin ng mamamayang Pilipino?
Last 5 minutes. Please answer, Dr. Andrea.
The meta-analysis did not show significant difference in terms of the adverse events, but our dictum is first do no harm. So our caution only is because we are not sure of what is the right dose, what is the correct dose in using ivermectin for treatment and for prophylaxis, because the trials use varying doses. So we need to be careful when we prescribe what dose are we going to give.
Medyo malinaw-linaw po yun. Ma'am, can we just request na meron po ba kayong inassign na task force under the CPG to really look into this? Kung anong dosing, kung yun lang po palang issue natin, yung dosing, ang mga dapat gawin, then maybe the Living CPG can actually form a task force and concentrate on this. Because if there's really hope for this, then maganda po na magawa natin ang paraan sa sarili nating bansa.
Yeah, in our meta-analysis, we look at the doses also. And plus, we are about to start the clinical trial, looking at the high dose and low dose. So which one is the appropriate dose? Okay. So
Maraming salamat po for that. Mr. Chair, actually ang dami ko pang tatanungin pero hindi kasi regarding this one. I still have 5 minutes pero mamaya bago ko matapos si Dr. Rafi Castillo would like to answer, pero wag mo kunin sa time ko, Mr. Chair. Meron lang akong gustong i-take up kasi on patent issue because this is important. I don't know if kasama na natin ang IPO with us. Are they here? Wala pa yung IPO? Okay, siguro later na lang kasi merong mga patents na kailangan ma-release natin in the time of pandemic and I'd like IPO to talk about that. DOST, is DOST with us? Yan. Yes, siguro from DOST, pag may mga bagong inventions, can we support our scientists and doctors? Wala rin sa so patawag na lang natin even for later. So sige, so since wala naman yung ibang tatanungin ko, let us recognize Dr. Rafi Castillo, please.
Dr. Rafi Castillo, for your statement on the Living CBG.
Actually, yes. Thank you, Mr. Chair and DS Herrera. Yes, I just like to point out, because I think we have a lot of real-world evidence, which are very pertinent, very relevant, and this seems to be ignored by our regulators, by our guideline drafters. Real-world evidence of ivermectin being distributed to populations and see remarkable reductions in the transmission of COVID and the prevention of death. In Uttar Pradesh, for example, in India, and I think we should look into that because I think it's a very good model for the Philippines. Uttar Pradesh is the most densely populated state in India with 230 million population, bigger than ours, more than twice as ours, and yet the transmission rate with the current surge in India, the transmission rate is 72% less, and their death rate is less than 62% compared to the rest of India, excluding Uttar Pradesh. And just over the weekend, the head of the government of Uttar Pradesh came out with a statement. They were sharing, and they were very confident in sharing that their main secret is the timely and early use of ivermectin since August of last year. So despite being the densely populated state, logically they should be one of the most severely affected states in India, but they're the ones doing very well compared to the other states of India. And we have a lot of similar other real-world evidence. Chile, Mexico, Paraguay, Czech Republic, and several other countries. So I was just wondering why these data are not considered. And why these real-world data are not considered. And I believe these are even more pertinent, relevant data. You know, these are because this is where the rubber meets the roads. Sabi nga natin you only know a car is good when you test drive the car, when the rubber meets the road. Ito yung mga data where the rubber meets the road, real world evidence. And I think our FDA will be more efficient in processing not only ivermectin, but other product applications if they are more pragmatic and consider real world evidence. We may look into the 21st Century Cures Act in the US, which are streamlining operations of the FDA and considering more real-world evidence rather than just randomized controlled clinical trials. So I think we should veer away already from randomized controlled trials and also consider real-world evidence. Thank you, Mr. Chair.
Thank you, thank you.
Yes. Mr. Chair, thank you. Last question na lang ako kay Dr. Alejandria. Doc, at saka kay Dr. Dance or the whole Living CPG, paano po ba pwede maging membro nyo si Dr. Dalmacion? At yung, I know, but I'm serious. Kasi sometimes, kailangan mas varied yung ating membership eh. Ma'am, can I request that you submit to us kung sino yung magko-compose nung, kung magsabi mo nga you'd form a team to seriously look into this? Because if like you said, there's no adverse effects in all the clinical trials that you have studied and that it's just the dosing na ang problema, then seriously, we have to create that task force as soon as possible. Can we count on you on the Living CPG to help us on that one? Kasi para once and for all, masettle natin. Kasi if it's something that can really cure us, then that's something that we really need at this point. Hindi naman po ito to compete with the vaccines that we have or kung ano mang meron, pero at least another option for the Filipino people.
Chair?
Yes, please proceed. Please answer.
Can Dr. Dance, Antonio Dance, one of our project advisors, answer that?
Yes, Dr. Dance.
Yes, good afternoon, everyone. I'm wondering if I can be heard.
Yes.
Yes.
Yes, good afternoon. Yeah, thank you very much for allowing me to speak. I'd like to start with my conflict of interest. I have no financial conflicts of interest with the use of ivermectin. In fact, I hope it eventually turns out in studies to be an effective drug. We really need something to be able to give our patients. I guess my only conflict of interest is Dr. Inday Dance is my household boss, and she leads the living guidelines. I'd like to say three things, ma'am. Number one is that when you talk of serious adverse effects, the serious adverse effects among patients given ivermectin is 5 times higher. These serious adverse effects are side effects that lead to cessation of the drug, a life-threatening condition. So it's 5 times more, but it is not statistically significant. And in our view, the most dangerous drug is a drug that has no effect. And that's why even if you give a very relatively safe drug, but it has no effect, its rare dangers can become significant. The second thing I want to say, and third thing, relate to what Dr. Dalmacion represented kanina, which is disagreement in meta-analysis. Yung meta-analysis lang naman po is a summary of the different trials that have been done on a particular drug. And there are 2 dangers na I think pwede hong maintindihan ng grupo dito. The first danger of a meta-analysis is called heterogeneity. Napakalaking danger. It's an ethical, moral, statistical, and technical danger. Bakit ko po sinabi yan? Let's say a drug is tested in young people and it shows it kills young people in one trial. And then in another trial, it reduces the mortality of older people. So it saves the old and kills the young. But when you summarize, you will see that it has no effect. That is a very dangerous conclusion. To say that based on these 2 trials, this drug has no effect. Because it killed the young and helped the old survive, you should avoid it among the young and actually give it to the elderly. The conclusion na walang effect is dangerous. That's why we don't like to join trials na iba-iba ho yung tanong, iba-iba ho yung subject, iba-iba ho yung dose. And the statistical tests that Dr. Dalmatian talked about, they are not reliable in detecting heterogeneity. The only way we can protect against heterogeneity is by closely analyzing the studies. And the example I gave you about killing the young and saving the old is actually not an imaginary example. It's a real example from a real drug. So one of the suggestions po that I'm giving, and which will explain the differences in the different meta-analysis, is address naman yung heterogeneity. Huwag yung magsasabay-sabay ng iba-ibang drug combination, ivermectin plus hydroxychloroquine, ivermectin plus this drug, yung iba compared to placebo, yung iba compared to other drugs. Those are frank heterogeneity, and those are very dangerous combinations because pinagsasabay mo situations where they help and where they don't help. So that's one danger. The second and last danger I want to point out was already pointed out by Dr. Dance. It's the quality of evidence. Kung pangit ang, kahit na maganda yung effect, reduction in mortality, kung pangit ang evidence, then that's questionable evidence. And in fact, if you look at all the meta-analysis on ivermectin, whether done by the proponents or not, they all agree that there were less deaths on ivermectin. But they all agree that the evidence is poor. So anong gagawin natin if the evidence is poor? Diyan ho nagkakaiba ng decision kasi pareho rin hong resulta ng mga meta-analysis, less deaths on ivermectin, but the evidence is low, very low, or at best moderate. The only difference is that some people think with low quality evidence, you can already give it. And the other doctors, I would believe, most doctors believe na kailangan better quality in evidence before you finally give it. So my heterogeneity, kita yan ng lahat. Low quality evidence, nakita yan ng lahat. Ang nagkaiba lang ho sa value judgment.
Thank you po.
So, yun lang po. I hope that explains bakit iba-iba ho yung results. Pero pare-pareho naman ng findings, iba lang yung conclusion.
Thank you po.
Mr. Chair, since marami na tayong resource persons and I don't have time anymore, hahayaan ko na lang yung ibang representatives to call on the other resource persons to answer this. Pero sir, sana last, andyan na yung IPO. Kung lang sa patent, they could quickly lang say kung ano yung kailangan nating palitan to lift the patent because it's very critical in this time of pandemic.
Any representative from the IPO?
I think George San Diego is there from IPO.
George San Diego? Andyan po. Ayan.
Andyan na po si George San Diego and then the next legislator na baka mapagalitan na ako. Thank you, Kong Mike. Thank you, Deputy Speaker Marcoleta. And thank you.
Ayun na po. Okay. Yes, no, there's only one question you need to answer from DS Herrera. DS Herrera, please proceed.
Yes, Mr. Santiago, no need for the presentation. Quickly lang, ano ang kailangan ba na ngayon na meron bang mga kailangan i-lift para, bakit importante na may mga patents tayong ma-lift during this pandemic?
I do, ang sitwasyon po kasi dati, nung pre-pandemic, yung mga patent holders masyadong mahigpit. Ngayon po, under yung mga rules, particularly Section 93, andun po lahat. And besides, nakalagay dun, only the Director General can issue licenses, compulsory licenses. Sino importante po yung compulsory licenses? You can compel any patent holder na gamitin mo.
please submit your position paper on how we can lift the patents on certain drugs in this pandemic. Next to interpolate, thank you. Thank you, DS Herrera. Next to interpolate is DS Marcoleta. You have the floor. You are recognized.
Maraming salamat po, Mr. Chair. Do I understand, Mr. Chair, that the representatives from the FDA, I think there are 2 undersecretaries and 4 others.
I'll give you 25 minutes, DS Marcoleta. Thank you.
Is it our impression that they are authorized to speak for the Director General on behalf of the FDA?
Director General Oscar Gutierrez, please answer. Deputy Director General Gutierrez.
Yes, sorry po, Honorable Chair. On behalf po of the FDA Director General, I have, as the OIC now of FDA, I can entertain questions for related to our topic. Salamat.
Mr. Deputy, on May 5, 2021, President Duterte asked Director Domingo if there is an iota of success up to now on ivermectin. Ang sagot po niya ay hinihintay pa po niya ang 1 buwan o 2 buwan bago siya makakalap ng mga ebidensya para masagot ang tanong ng Pangulo. Alam po ba niyo yung tanong na yun, Director?
Opo, Congressman, alam ko po yun, napanood ko po yung segment na yun. Opo.
Ang tanong po ng Pangulo, if there is an iota of success. Alam po ba ninyo yung ibig sabihin ng iota?
Opo.
Kakarapot, katiting, gakurot. Tama po?
Tama po.
Bakit naghihintay pa siya ng 1 buwan o 2 buwan para makakalap pa ng ibang ebidensya? Ano po bang ebidensya ang hinahanap pa ninyo? Ang sabi niya, dahil sa inyong mga espesyalista, kailangan pa ng 1 o 2 buwan pa.
Meron po kasing mga ongoing clinical trial, yung randomized clinical trial, yung iba pa po ay double-blinded po na malapit na pong matapos. Yan nga po yung napag-usapan bago nyo po ako tanungin, nakikinig po ako, talaga pong malapit na rin po matapos nila yung mga trials na yon. Inaantay lang po ng FDA na magkaroon po ng conclusive findings po base po dun sa mga trial. At base po dun sa sagot po ni DG, meron pong clinical trial na ginagawa po locally. At within 5 months, pwede po tayo magkaroon na ng initial findings. Pero tatakbo po yun ng clinical trial mga 1 taon.
Director,
yun po, Congressman.
Napakahaba ng sagot ninyo. Tinatanong ko lamang, ang tanong ng Pangulo kung merong iota of evidence. Bakit hindi po nyo sinagot kung meron o wala? Kasi ang iota, katiting, karampot. Wala po kayong nakita kahit nakatiting o karampot ng katibayan ng success ng ivermectin nung panahon na itanong niya yon?
Nung nagkaroon po ng...
Tinatanong ko po kayo, wala kayong nakita kahit iota of evidence ng success ng ivermectin?
Kasi po ang FDA po, wala po kasi...
Natanong ko po kayo kung wala kayong nakita ng iota of evidence.
Wala po kasi nakabase po tayo sa clinical findings po ng mga expert po.
Nino po?
WHO. Meron pong mga expert po na tumitingin sa mga randomized clinical trial.
Director,
opo.
Ito po ang katotohanan. Sa worldwide experts clinical trials, meron na pong 54 trials as we speak. 442 scientists, 17,600 patients. Ang tinatanong po ng Pangulo, if there was an iota of success. Ito pong mga ito na ginawa ng mga dalubhasa ng mga doktor sa iba't ibang bansa. 27 randomized controlled trials. 85% improvement in prophylaxis trials, 80% improvement in 20 early treatment trials, 47 improvement in 20 late treatment trials, 74% improvement in 20 mortality results, 66% improvement in 27 randomized controlled trials. Ito po ba ay hindi nyo kinikilala, Director?
Meron po yung mga grupo po na
Natanong ko po kayo, hindi nyo po kinikilala itong ebidensyang binanggit ko sa inyo?
meron pong tumitingin po niyan, Congressman.
Kayo
Yung
po,
yung mga-
kayo ay opisyal ng FDA. Hindi po ba ito kinikilala ng FDA? Kasi ang tanong sa inyo ng Pangulo, if there is an iota of success, ang iota po kahit kakarampot, kahit gatiting. Ito pong binanggit ko sa inyo, buntun na po ito eh. Buntun na po ng ebidensya. Ang tanong ko sa inyo, hindi ba kinikilala na ebidensya ito ng FDA?
meron pong tumitingin yan po sa UP. Ang iba po, resort
Tinatanong ko po ang FDA. Paiba-iba po kayo, kaya po tayo nagtatagal eh. I am asking you, in the name of FDA, does FDA officially recognize this or not?
Kung hindi po mag-a-apply po ng authorization from
Ito ang
FDA,
nagsasabi na hindi mag-a-apply. Ito po ay mga dalubhasang doktor sa iba't ibang bansa. Ibig po ba ninyong sabihin, meron pa po kayong kinikilala rito sa ating bansa na mas dalubhasa dito sa mga taong ito? Halimbawa, galing na ng Amerika ito eh. Israel, Belgium, Australia. Napakarami po nila eh. Ang tanong po ng Presidente, if there is an iota of evidence, hindi ninyo sinagot ang Pangulo. Bakit?
kasi nga po, ang FDA po ay, ang trabaho po ay mag-assess po ng mga applications regarding indications, kung ano po yung claim ng product.
Wala po kaming pakialam doon sa trabaho ninyo. Ang tinatanong ko po sa inyo, tinanong ang Director General ninyo ng Pangulo ng Pilipinas.
Opo.
Hindi ninyo sinagot ang totoo. Ang sabi niya, is there an iota of success? Huwag kayong lalayo doon para makatapos tayo. Kaya tinatanong ko sa inyo, bakit nagsinungaling? E dito po, nandito po, meron kayong professional dishonesty, concealment, if not deliberate deception. It is the President of the Philippines who asked the Director General if there was an iota of success. Wala kayong sinagot. Ang sinagot niya, maghihintay pa po ng 1 o 2 taon o dalawang linggo.
Opo.
Bakit po? Bakit hindi po niyo sinagot ng diretso?
Congressman, mawalang galang na po. Ang FDA po, ang mandato po niya ay siguraduhin po na yung mga produkto po, lalo na po mga gamot, ay safe, effective, and good quality. Dapat po may matibay po na basihan para po kilalanin natin.
Sabi sa inyo na hindi yan ang tanong ko. Ang dapat ay sinagot ninyo ang tanong ng Pangulo. Eh di dapat ganyan ang sinagot ni Director Domingo kung gaano mo sinasagot. Bakit hindi ganyan ang sinagot niya? Ang sabi ni Director Domingo, maghihintay pa ng 1 hanggang 2 taon.
Kasi
Hanggang 2 buwan. Okay? Bakit? Pwede ba natin sabihin sa tao, maghintay ka muna, huwag ka munang mamatay?
Mawalang galang na po.
Yun.
Kasi po nung panahon na tinatanong po siya, meron pong direktiba ang Presidente ng Pilipinas na mag-conduct po ng clinical trial locally. So,
nandun na ako, Director eh. Paulit-ulit ka eh. Wala akong pakialam kung meron na tayong ginagawang clinical trial. Ang tinatanong ng Pangulo noong Mayo 2021, is there an iota of success up to now? Sabi niya. Binanggit ko sa iyo, itong mga ginawa ng mga dalubhasang mga doktor at mga scientists at eksperto sa iba't ibang bansa. Bakit hindi nyo sinabi sa kanya ng diretso sapagkat ang tinatanong niya, iota of success?
Opo, kaya nga po nag-conduct po ng local clinical trial kasi may iota po.
Sinagot na merong higit pa sa iota of success. Yun ang gusto kong sabihin sa inyo. Bakit hindi mo sinabi na tunito-nilada na ebidensya meron na ginawa sa ibang bansa? Hindi nyo ba kayang aminin yun sa Pangulo?
Yung local clinical trial po, nakabase po yan sa findings po ng mga clinical trial na naganap na
Director,
Kulang po,
ano ka ba?
kulang po ang ebidensya.
Naiintindihan mo ba yung tinatanong ko? Naiintindihan mo ba? Walang sinasabi ang Pangulo na local trials. Ang sinasabi ng Pangulo kung meron sa ngayon, available, kahit anong parte ng daigdig. Kanina ka pa, hindi mo sinasagot ang tanong eh.
Meron pong
findings. Papalayo?
Meron pong ginawang pag-aaral po ang WHO na sinasabi niya po, kulang
Hindi
po
ko
ang
tinatanong ang WHO, ang tinatanong ko ang FDA director. Kaya nga tayo nagtatagal eh. Bakit hindi kayo sumabay? Halimbawa, Amerika, Australia, okay? Belgium, Israel, United Kingdom.
Wala.
Bakit hindi kayo sumabay?
Mawalang galang na po. Doon po sa mga bansa na nabanggit nyo, wala po akong napag-alaman na meron pong nagrehistro ng produkto ng ivermectin para po sa COVID. Wala po tayong makikitang rehistro ng ivermectin na ang indication niya ay para sa COVID.
Mr. Chair, pwede bang
Pero
ginamit
po siya sa
pwede
national.
ba pagsabihan natin ng ating resource person na kung ano yung tinatanong lang, doon lamang ang sagutin niya. Wala akong sinasabi sa gamot. Ang pinag-uusapan natin dito, clinical trials. 54 trials, 442 scientists, 17,600 patients. Hindi ba nyo kinikilala ito na ebidensya? Ang tinatanong po ng Pangulo, iota of evidence. Hanggang ngayon ba hindi mo naiintindihan ang tanong?
Naiintindihan ko po, Congressman.
You have 10 minutes, DS.
Congressman, mawalang galang na po.
Ayaw nang sagutin eh.
Hindi, mawalang galang na po. Ang mandatum po kasi ng FDA ay siguraduhin po lahat po ng gamot na nasa market o gagamitin po ng gobyerno ay safe, effective, and quality po. At ito po ay nakabase sa scientific evidence po. Yung pinag-uusapan po kanina, yung evidence-based medicine po at nakasalalay po siya sa sa mga clinical trial po na dapat po ay properly done, properly designed, at isa pong random clinical trial po. Usually po, double blind po yan. So, delikado po kasi na ang FDA basta na lang mag-a-approve ng produkto kasi meron pong mga tao na sensitibo, yung mga buntis po, mga bata, at yung mga yung may comorbidities din. So lahat po yan, makaka-approve po yan ng clinical trial.
Nauubos lang ang panahon ko sa iyo, Director eh. Nauubos lang ang tanong ko sa iyo eh. Ang tanong ko lang ang intindihin mo. Meron nang gumawa ng clinical trials na nagpatunay na may bisa, may benepisyong ivermectin. Tinanong ng Pangulo kung meron kayong alam na iota of evidence ng success. Yun lang ang tanong. Hanggang ngayon hindi mo masagot-sagot. Ang tinatanong ko sa iyo, bakit hindi nyo sinabi sa Pangulo na meron po, marami pong trials na po ang ginawa sa iba't ibang bansa katulad ng Amerika, ng Australia, ng Belgium, ng UK, at ng Israel, Argentina, napakarami. Bakit hindi ganun ang sinagot ninyo? Bakit ang sinasabi mo maghihintay pa kayo? Kaya nga tanong ko sa inyo, hindi nyo ba kinikilala itong ginawa ng mga dalubhasang doktor na ito na ebidensya rin para sana nasagot ninyo ng tama ang Pangulo ng Pilipinas? Naiintindihan mo ba yung tanong ko?
Naiintindihan ko po.
Bakit hindi nyo sinabi sa Pangulo na merong higit sa iota of evidence? Tunilada ng evidence, meron. Ba't hindi ganun ang sinagot nyo?
Mawalang galang na po. Congressman, meron
po. Bakit hindi ganun ang sinagot mo kung naiintindihan mo ang tanong?
Ito na po. Yung pong iota of evidence, ang sinasabi po doon sa pumasa sa screening ay kulang pa po ang ebidensya. Kaya nga po.
Sino bang gumagawa sa inyo sa lokal natin? Sino ba yung sinasabi ni Director Domingo na eksperto? Sabihin mo sa akin, sino ang eksperto nating lokal na nakagawa na ng isang clinical trial kagaya ng ginawa sa iba't ibang bansa? Sino na ang nakagawa?
Marami po. Nasa PCHR.
Sino nga? Bigyan mo ako ng pangalan na nakagawa na ng clinical trial na sinasabi na ang ivermectin ay walang bisa. Sino sa inyo?
Dito po sa Pilipinas, wala po akong alam na local clinical trial na ginawa po.
Wala kang alam eh. Wala kang alam na mayroong nakagawa na walang bisa ang ivermectin, pero ayaw mong kilalanin yung mga taong dalubhasa na nagsasabi, tunit-tuniladang patotoo na mayroong bisa ang ivermectin.
Kasi nga, mawalang galang na po.
Teka muna, wala na yan. Ang sinasabi ko nga sa'yo, ni isa, wala kang masabi na local expert natin na nakagawa ng clinical trial na walang bisa ang ivermectin. Kasasabi mo lang. Ano ngayon, ayaw mong paniwalaan? Anong inihintay mo? Ba't ayaw mong paniwalaan itong mga ebidensyang sinasabi ng mga tao?
Mawalang galang na po. Yung mga clinical trial po sa Pilipinas, dumadaan po sa FDA yung protocol for approval at
Kaya
yung
nga,
investigatory trial for wala pa pong nag-apply.
Kung wala ngang lokal na nakagawa niyan, walang dadaan sa inyo kahit maghintay ka pa na 1,000 taon. Hindi ba? Wala ngang clinical trial na lokal eh.
Meron pong magaganap itong katapusan ng buwan po.
Congressman Joseph, Director, hindi natin masasabi sa mga pasyente na wag muna silang mamatay. Maghintay kayo ng 6 hanggang 8 buwan na sinabi ng director namin kay Pangulong Duterte, may gagawin kaming trial. Yun ba isasagot mo sa taong bayan? Alam mo ba kung ilan ang patay sa araw na ito, Director? Alam mo ba?
Mga 6,000 po. Pero mawalang
napatay ngayon, sa ngayon.
Napatay po. Mga less than 100 naman po.
Anong less than 100? Mula nung magka-COVID hanggang ngayon, alam mo na kung ang bilang ng namatay?
Ay, mahigit 10,000 na po.
19,191. Alam mo, 19,191. Anong ibig sabihin nito, Director? Tanungin kita. Hindi mo alam? Ang ibig sabihin nito, habang kayo nagpapatumpik-tumpik, habang hindi kayo makagawa ng desisyon, habang nag-aatubili ka, patuloy na mamamatay ang maraming Pilipino. Ang sinasabi ni Director Domingo, maghihintay pa po tayo ng 6 hanggang 8 buwan. Ito mo ba sagot ninyo? Kanina sinabi mo wala ni isang clinical trial na nagawa dito sa bansang ito. Walang eksperto, sinabi mo, na nakagawa ng clinical trial at kayo ngayon ay naghihintay pa sa WHO sapagkat yun ang inihintay ninyo. Pero ang itinapat ninyo, Mr. Chair, ang itinapat po nila ay yung tinatawag na wala silang masabi laban sa 1 toneladang sinasabi nating patotoo sa mabisang epekto ng ivermectin. Ang kanilang ginamit, Mr. Chair, ay yung statement na pinalabas ng Philippine COVID-19 Living Clinical Practice Guidelines ng UP, NIH, IC, etc., etc. Ang pinagbasihan po nila, Mr. Chair, kanina diniscuss ni Dr. Dalmacion, 6 na randomized control trials na di umano ay of good methodological quality. Tama po ba yun, Director? Ang pinagbasihan ninyo yung 6 na randomized control trials? Tama po?
Yung nakikinig po ako kasi po sa evidence.
Tama po.
Yun pong naintindihan ko po.
At
kasi po kasi
mawalang daw, Director. Pagka nagtatanong ako, tumigil ka muna.
Opo.
Yung 6 na yun ay pinili ninyo of good methodological quality at nagpatunay daw ng ivermectin ay walang significant na contribution laban sa COVID-19. Hindi ba? Ito yung statement na ginawa ng UP-NIH, Philippine COVID-19 Living Clinical Practice Guidelines.
Meron.
Ngayon, nasabi na ni Dr. Dalmacion kanina, napakaraming mali nun. Halimbawa, tingnan mo na lamang yung sinabi ni Dr. Dalmacion kanina, Director, isa sa pinagbatayan ninyo sa 6 na studies na ito, yung effect of ivermectin on time to resolution of symptoms, Eduardo Lopez Medina. Kahit na ako hindi doktor, Director, kapag binasa mo, ikaw kaya mong basahin ito, yung limitations ng study na ito, anong sinasabi? Babasahin ko sa'yo. This study has several limitations, sabi niya. First, the study was not conducted on completed according to the original design.
Nawala.
Hello, Kong Marcoleta, you're on mute. Hello, Kong Marcoleta.
Hello, narinig na po.
Hindi, kanina hindi ka narinig. Mga 2 minutes.
Yung pong pinagbasihan nila, isa sa mga 6 na randomized clinical trial daw po, itong Eduardo Lopez Medina na binanggit na po ni Dr. Dalmacion kanina, napakalaki po ng limitasyon. Unang-una, the study, nakalagay po sa mismong limitation nila, the study was not conducted or completed according to the original design. Isipin po ninyo yan. Common sense lang ito, Director. Sabi pa niya, and the original primary outcome to detect the ability of ivermectin to prevent clinical deterioration was changed 6 weeks into the trial. May tampering pa eh. In the study population, the incidence of clinical determination or deterioration was below 3%, making the original plant analysis useless. Ito yung mga pinagbasihan ninyo. Pagkatapos sasabihin mo sa amin ngayon na napakarami ninyong pinagbasihan. Sa totoo lang, alam mo, doon sa sinasabi ninyo na 6 na pinagbasihan ninyo, nasabi ninyo ay good clinical methodological quality, ang sabi pa ninyo doon ay systematic review. Binigyan pa nga kayo ng bonus ni Director ni Dr. Dalmacion. Hindi po systematic review ang ginawa nitong 6 na ito. Marunong din po tayong mag-analyze. Alam mo, Director, hindi ko nasasabi sa'yo, ako nakumpleto ko yung aking doctoral degree sa UP. Kaya alam ko ang distinction ng systematic review at saka literature review. Ang ginawa lamang po ninyo dito sa 6, literature review, hindi systematic review. Tandaan po ninyo yan. Ngayon, kung wala naman po kayong doktor pala, kasi po, Director, napansin mo ba itong COVID-19 living clinical practice na kung saan ay wala raw kakwenta-kwenta ang ivermectin? Ito ay kinapalooban ng 12 organisasyon, di ba? Meron, kasi binilang ko yung mga logos ninyo. 12 yun. Tama po ba?
Tama po yun.
Sino-sino ba sa mga doktor? Ito ang tanong, Director. Sino-sino po ba sa mga doktor na kasapi sa 12 organisasyon ito na bumuo ng statement na yon ang nakapagsagawa na ng clinical trial?
Wala pa akong datos ngayon, Congressman.
O wala?
Pero ang pwede ko pong sabihin...
Sandali lang. Pag sinabi mong wala talaga, wala ka nang ikakatwiran doon. Ang lakas ng loob ninyo na gagawa ng isang statement, 12 organisasyon, ni isa, katulad ng sinabi mo, ni isa, wala man lang nagawa na isang clinical trial. Anong katwiran nyo para sabihin ninyo ng ivermectin ay walang bisa? O ito pa, yung consensus panel ng representatives na nakalagay doon na nag-issue ng statement, sila ba ay technically o medically equipped para i-assail yung
1 minute. We need to we have a second round.
Are they technically and medically equipped to assail the 54 trials conducted by 442 scientists all over the world?
Yes po. They are the best doctors and physicians that we have in the country po.
Hindi ko sila minamaliit, Director. Pero ang sinasabi ko sa iyo, 54 clinical trials conducted in America, in Belgium, in UK, in Israel, in Australia. Ibig kong sabihin, mas marunong ito para i-assail yung 54 trials na sinasabi ang ivermectin ay mabisa? Are they competent to assail? Yun ang tanong ko sa iyo, baka hindi mo
Opo,
naintindihan.
Congressman, meron pong paraan para itong maraming
Ang tinatanong
studies.
ko sa iyo, hindi paraan. Ang tinatanong ko sa iyo, are they competent to assail?
Opo, they are competent po.
Mas magaling sila, mas dalubhasa sila sa mga eksperto ng ibang bansa na mas mataas ang kanilang level ng technology, mas
Opo.
malawak ang kanilang mga karanasan at ang kanilang mga pasilidad ay mas marami. Mas competent ang local doctors natin.
Opo, ang pool of experts po ng FDA nanggagaling po sa kanila. Ang kalidad po ng decision ng FDA nakasalalay po sa kalidad ng kanilang evaluation din po.
Paano mo
Lalo na
nalaman?
po itong clinical trials.
Paano mo nalaman na mas competent ang ating local doctors sa mga foreign doctors na nagsigawa ng clinical trials, 54 trials, 442 scientists? Paano mo sasabihin na ganun-ganun na lamang, parang napakasimple sa'yo, na sasabihin mo na mas dalubhasa ang mga doktor natin? Paano mo nakuha yung conclusion na yon?
Kasi po, well-regulated po ang ating medicine. May board of pharmacy.
Wala kung well-regulated ang ating
Board of
tinatanong ko sa iyo, saan mo nakuha yung konklusyon na mas marunong ka sa atin? Hindi ko minamaliit ang ating mga local doctor. Sana nga totoo ang sinasabi mo. Pero ang tanong ko sa iyo, anong basihan ng conclusion mo?
Hindi po ang basihan ng conclusion.
Ano nga sabi mo kanina, they are technically and medically equipped to assail the mountain and tons of evidence.
Tama po yun.
Ano ang basihan mo nga?
Yung sinabi ko po kanina,
Ano
na
yung sinabi mo?
they are a well-regulated profession po under the Board of Medicine po ng PRC.
Lahat naman regulated ang profession. Tinatanong ko sa iyo, ano ang...
DS Marcoleta, you have exceeded the time allotted for the first round.
Ay sana po kung ang mga sumasagot hindi kagaya nitong director na ito, mapapadali po sana ako, Mr. Chair. Pero kamukha nitong huling tanong ko, tinatanong ko siya kung anong basihan niya, paano niya nasabi.
Siguro bigyan natin ng konting time pag sa second round makaisip na siya.
Sige, isipin mong mabuti, iwanan muna kita. Salamat, Mr. Chair.
Maraming po salamat, Congressman.
We will come back to you again, DS. Kong Mike Defensor for your first round, 20 minutes.
Mr. Chair, bago lang recognize si Kong Mike, I'd just like to put on record na nagre-request po si Dr. Alan Landrito and Dr. Iggy Agbayani to do a very, very quick presentation. Pero kahit mamaya na po after the first round.
After the first round of interpellations.
Thank you, Mr. Chair.
Thank you. Kong Mike.
Yes, Mr. Chair. Mr. Chair, if I may quick lang tong share screen ko. Una po, tatanungin ko po yung DOH. Kung meron po ba ang sasagot, Mr. Chair, because from the messages, parang wala si Yusek Guerrero.
Wala nang tiga DOH dito. Umalis na daw.
Okay, Mr. Chair, just to start the discussion, sinabi kanina ni Professor Dance na yun daw hong fear niya, yung mga doktor daw ho ay yung absence of or evidence of efficacy mas delikado. Pero in a survey conducted in the Philippine American Association of Scientists and Engineers, yung 553 doctors na nagkaroon ng survey, ang sinabi po ng mga doktor, majority, they want and they're willing to have it tested for preventive and curative. Mula po sa pag-prevent, nanalo po majority na boto ng mga doktor, at nanalo rin po yung sinasabing gamitin sa cure. So galing na po sa mga doktor yan. Wala na po tayong debate tungkol dito dahil survey po na ginawa yan. Ito po, Mr. Chair, ang sitwasyon natin ngayon, okay, sinabi nila, binigyan na namin ng Lloyd's Laboratory, pinapayagan na namin yung mga compounding, prescription ng doktor, and yet, ang mga doktor po natin, nakalagay po dito, isinabmit ng Department of Health ang pangalan nila sa Professional Regulation Commission. So, if I may know, wala po ba ang DOH? Kung wala po, from the FDA, Mr. Gutierrez, kayo po ba kasama dito sa submission sa PRC na tanggalan ng lisensya mga doktor?
Personally po, wala pa akong information regarding this po.
And institutionally, FDA is not part of this?
Tama po yun.
So hindi po kayo nag-submit sa PRC na tanggalan ng lisensya mga doktor?
Wala po akong alam tungkol sa listahan na nag-submit ng FDA po sa PRC.
No,
Wala
let's
wala
be
pong information. Wala pong ganyang ginawa ang FDA
okay. So walang ginawa. Period.
na nag-submit. Opo.
Wala po period. So for the record do, kasi under oath naman tayo. Then I will ask now yung ating pong PMA. Nakita ko po nandyan yung ating mga PMA. Andyan po ba? From the Philippine Medical Association. Attorney Olarte ata nakita ko.
Attorney Leo Olarte, please respond.
From the Philippine Medical Association.
Dr. Benito Atienza.
Yes, sir. Present, Dr. Olarte po.
Okay, Dr. Olarte. Tanong ko lang po, nakalagay po sa inyo na hindi pwedeng mag-issue ng prescription ang mga doktor. At kailangan lang gamitin to sa mga ospital.
Opo, basta hindi po rehistrado ang gamot, hindi po kami nag-advise sa aming mga membro na mag-prescribe po ng gamot o mag-distribute. We are not after here whether the drug is nakakaigi o hindi nakakaigi. Ang amin lang po dito na yung gamot ay rehistrado. Kung rehistrado po yan, the PMA will advise distribution and prescription by the doctors. Pero kung hindi po rehistrado ang gamot para sa COVID-19, hindi po kami magbigay ng abiso.
For the record, Dr. Olarte, para lang humalinaw, inaprubahan na ng FDA ang Lloyd's Laboratory and they are here with us. So ang ibig niyo po sabihin, dahil lang nematode ang approval niya, ay hindi niyo papayagan ang mga doktor ninyo mag-prescribe off-label.
Hindi po kami nag-a-advise mag-prescribe off-label. No, that is not beneficial.
No. Let's be clarified. Let's be clear. Kasi ang batas po natin allows off-label. Ang US sa Estados Unidos po pinapayagan off-label. So dito po sa atin, off-label is allowed. Legal po yan.
Hindi po legal yung off-label. Halimbawa, ang gamot is registered for parasites. That is
clarify po natin
label po. Yes po, abogado
Dr.
po
Olarte,
ako.
i-clarify po natin ang sinasabi nyo, illegal ang off-label?
Yes po. Kasi po, pag ang gamot, halimbawa, ivermectin, is registered for parasites. Yun po ang label niya. Ngayon, pag sinabi mo pong off-label, teka lang po, no? Pag sinabi po ninyong off-label, ibibigay mo po yung ivermectin for another disease that is not indicated. So that is off-label po. Kaya po, hindi po magaling yan para sa pasyente.
Ang tanong po, Dr. Olarte, is yung legal o illegal eh. Sabi niyo po, illegal.
Illegal po, sa akin po. Akin opinion po, illegal po yun.
So pag hindi po registered at nirekomenda ng doktor, ayan po ay dapat kasuhan.
Siyempre po, pagka hindi po siya sumunod sa labeling ng gamot po, katulad po ng ivermectin, which is labeled for parasites. And then, ibibigay mo po off-label for COVID. Hindi po siya rehistrado for COVID specifically, no? So, pag nag-prescribe po ang mga doktor ng unregistered drug for a specific disease or illness, hindi po magbibigay ng konforma ang PMA niyan po.
Okay, so mas masama po talaga pag hindi registered. Kasi ang off-label registered pero pinescribe. Lalong masama po pagka hindi ni-register talaga.
Ano po?
Hindi po registered yung gamot tapos nagkaroon pa at ginamit, lalo hong masama.
Opo, hindi po registered for COVID po, masama po yan.
Yung totally
registered po.
Yung totally hindi registered, mas masama pa ho pa. Di ba ho?
Yung hindi registered?
Opo.
Ivermectin is not registered for COVID.
No. Doc, let me clarify. Yung ivermectin kasi nematode, so registered na siya, pero pag off-label sabi nyo hindi pwede. Sabi ko nga po, mas masama pa talaga pag lalo pang walang gamot na registered, hindi pa na inapurbahan. Tapos ginamit, mas masama pa ho yun at binigay ng doktor.
Yes po, basta hindi registered po for a specific illness, hindi po namin nire-recommenda na i-prescribe po ng mga doktor.
At illegal
Ganun
po.
po ang PMA.
At illegal po.
Ano po?
Illegal po, Doc.
Illegal po basta hindi rehistrado for a specific illness or disease.
Eto po kaya, Doc, anong tingin nyo dito? Hindi po registered kasi yung Sinopharm eh.
Meron pong merong compassionate use po. So meron po kasi mga exceptions, no? May compassionate use permit 'yan. So
Opo, alam niyo po ba, Doc, ang definition ng compassionate use? Alam po natin yung definition ng compassionate use?
Opo. Opo.
Alam niyo po?
Yes po. Yes po. Exemption po 'yan sa registration dito sa ating gamot.
Yan po ang definition ng compassionate use. Based on ang tawag po dyan, expanded US access US FDA. Ang ibig pong sabihin, ang pasyente may threatening condition. Number 2, there is no comparable alternative. Ang patient is under clinical trial. Tapos yung potential risk na iimbestigahan. So hindi po ba babalik ako ha? Ito po. Bakit hindi niyo po sinasabing illegal yan?
Mayroon po siyang exemption.
Wala
Exemption
po,
po siya.
compassionate basahin niyo po yung compassionate special permit ng DOH.
Yes po.
Opo. Kung nakalagay po doon, pagka po talagang dying na yung patient, delikado na, the doctors and the hospital institutions allow compassionate special permit. Meron po tayong mga ibang vaccine na may FDA under emergency use authorization. Dapat po kasuhan din niyo po yung nag-injection niyan, di po ba?
Yes po, kung wala sa exemption po, but ang pagkaalam ko po yung Sinopharm na injected po sa ating Pangulo was given a compassionate use permit.
Oo nga po, pero
Yan
emergency
ang
use authorization po dapat dyan, Doc. Kasi hindi naman dying si Presidente eh. Di ba dapat alam niyo po yan as a PMA, legal advisor? And dapat it is not a compassionate special permit because all vaccines are under emergency use authorization.
Opo.
Tama po.
Alam niyo po, it is not for PMA to question na binigyan po ng FDA yung compassionate use permit. Pag binigyan po, we accept that as a performance of regularity po, no? Because this is a government agency. Hindi po namin question yan. Binigyan po yan ng
hindi, I'm just looking at your consistency, Doc, kasi 'di ba dapat sinabi nyo ang lahat po ba ng vaccines EUA? Opo, lahat po. Ako na po magsasabi sa inyo. Mr. Gutierrez, tama po ba lahat ng vaccines EUA?
Sa ngayon po, para po ma-approve ma-authorize ng FDA.
Ang tanong lang ho, di ba ang classification ng vaccines, emergency use authorization, tama po?
Yun. EUA lang po sa ngayon ang paraan ng pagkuha po ng authorization. Pero meron po tayong compassionate special permit.
Teka. Hinto muna tayo doon. So magmula kay Pfizer, ang inapprove nyo na po, Pfizer, AstraZeneca, Sinovac, meron na po kayo recently, may dalawa pa ho. Lahat po yan under emergency use authorization. Tama po?
Tama po yun. Meron pong isang
isang tanong lang ho. Emergency use authorization lahat.
Meron po nag-apply niya ng EUA.
Can you define to me the compassionate special permit or expanded access?
Ay wala po tayong expanded access po sa USFDA po.
Compassionate special permit. Kasi pareho po yun, Doc, Mr. Gutierrez. Ang expanded special permit, kung titingnan nyo po ang definition nila, is the same as a compassionate use.
Hindi naman po. Papaliwanag ko po ng konti.
Sige po.
Yung compassionate special permit po, kapag ang produkto na kailangan ng isang doktor o institusyon ay hindi po rehistrado sa Pilipinas. Pero kailangan po itong gamot na ito para gamutin o i-mitigate po ang disease, i-prevent ang disease ng isang institution, doktor. Yun naman po
Life-threatening or serious condition. Kasi may protocol kayo. Pagka hindi na po pwede yung protocol, then you allow us compassionate special permit. Tama po?
Ang importante po, hindi po siya rehistrado pero kailangan po siya ng pasyente. Ito na pong EUA, kailangan po ito makakuha ng authorization sa FDA para magamit po ng general population. Hindi rin po siya registered pero ang intention po natin ay gamitin siya for the general population.
I-clarify niyo po, Mr. Gutierrez, i-clarify mo muna yung compassionate kasi nasa,
ito na nga po.
meron kayo dyan eh. Di po ba si Secretary Fabier nag-issue niyan dati nung sa emergency use authorization at saka compassionate? 1992.
Yeah.
Oh. So ito po, pag life-threatening or serious condition ang compassionate special permit.
Opo, in-update na po natin yan. May bago pong issuance noong 2019. Ang sinasabi po doon, yung isang doktor o espesyalista o institution, pwede po magpasok niyan sa Pilipinas, pero hindi po siya authorization for general use, for specific patients lang po. Hindi po siya para sa general population. Yun po ang kaibahan.
Kaya nga po. So ang sinasabi po natin, kasi maganda naman yung posisyon niyo, sabi niyo hindi kayo nagkas sa FDA. Ang sinasabi ni Attorney Dr. Ollarte, kailangan daw Ollarte. Ang sinasabi po niya, dapat kasuhan yung mga nagkaroon ng prescription, di ba ho, ng ivermectin outside of the CSP. Ngayon, pinakita ko naman tong yung kay Sinopharm na hindi registered, hindi naman daw dapat kasuhan. Bakit wala akong consistency?
May consistency po yan, sir. Kasi ang sinasabi ko po, mayroong exception. May exception po to the unregistered ivermectin. Ang exception po
we have 8 minutes.
Or the emergency use authorization.
Okay,
Yun po ang exception.
Huli na lang po para makita po ninyo to ha. Para
wala naman po kaming naibigay ng statement yata na tatanggalan. Wala naman po kaming naibigay ng statement yata na tatanggalan po natin or bawal mag-prescribe. Ang position lang po ng Department of Health, because we have done this living CPG evaluation with the other experts, and that's why we have adopted that recommendation. And the position of DOH would be, we are open to further study so that we can see the evidence that it really would be providing benefit for our population.
Yung unregistered, pwede po yung mag-compounding. So yung pong pharmacy, kukuha lang po siya ng ardent activity po yun sa license niya, yung compounding. And they just have to follow regulations to make sure yung quality po ng kanilang produkto ay acceptable for humans.
So therefore, DGM Domingo, Dr. Domingo, yung sinasabi ni Yusef Bergere, para ako nagkaroon ng pwede mag-prescribe ang doktor at pwede mag-kunin sa isang compounding laboratory.
Basta po, ang palagay ko lang po kasi yung po siguro sa amin ng DOH nun is kasi nga po yung panghayop po siguro yung naisip na hindi pwedeng ireseta sa tao. Pero kung compounding po, pwede po. So, ng FDA, ang doktor ay may karapatan mag-reseta. Kahit naman po off-label use, although we don't encourage it, it is not illegal. So never naman po nagsabi ng FDA na makukulit.
Ayan po, napakalinaw ng mga sinabi ng mga otoridad. Babalik po ako sa PMA, pati po yung PCP, kasi kasama po dyan ang PSMID. Sinasabi nyo po, ang DOH po kasi wala dito. Pero ang DOH pinapatanggalan ng lisensya yung mga doktor na nagpre-prescribe ng ivermectin. Nag-survey po ang mga doktor, panalo pa rin na gamitin for preventive at cure ang ivermectin. Kung titignan niyo po ang nangyari, ang Department of Health, ginigipit ang mga doktor, kinausap ang PMA, kinausap ang PCP, na para bang kahit na ay naprubahan ang ivermectin sa merkado, pinayagan na mag-register, wala na pong magpre-prescribe. That is how they are treating ivermectin. Nung una hindi na maawat yung produkto, umiikot, ngayon they're saying kahit na nasa mercury drug na yan, kung wala mag-prescribe, sino makakagamit ng ivermectin? So Dr. Larte, for the record, because you're under oath, is that your position? You've heard the DOH. Narinig niyo po ang FDA. Naririnig niyo kayo ng FDA. Pwede mag-prescribe under a compounding laboratory. Kayo po nagsasabi pa rin, hindi pwede.
Under a compounding laboratory po, ang ibig mong sabihin na because it is compounded by a laboratory, even if it is not registered, pwede po mag-prescribe ang mga doktor. Yun po pa ang inyong ibig sabihin?
Hindi, pareho. Kasi may registration na tayo. Lloyd's Laboratory is already registered. So you can already prescribe that off-label. Under a compounding, sinabi na ng DOH, FDA, pwede. Kayo na lang ho nagsasabing hindi. Ginigipit nyo yung sarili nyo mga doktor.
Hindi po namin ginigipit ang doktor. Sa amin po, no, we are very liberal in the interpretation of the law. Ang amin lang po, gusto lang po namin yung mga doktor namin ay nasa legal and they're in the safe on a safe practice of medicine, ethical practice. No? Kung hindi po rehistrado ang gamot, hindi po kami mag-a-advise na ito-prescribe po yan. Now,
Doktor, iniba niyo po yung kwento eh. Meron nang registered. Meron pang compounding. So they are allowed to prescribe therefore.
No po, yung compounding and registered are different. A laboratory like
I'm giving an example. Merong compounding, meron po mga registered. Sa registered, they can do off-label. Sa compounding, they can do a prescription.
Yung compounded drug by a laboratory that has been given permit to compound does not mean to say that the compounded drug is registered for COVID and that the doctors can safely
do not mix the issue. The first issue is, if it's a registered drug and they prescribe off-label, is it legal or not?
It is illegal po. Sa aking opinion, that is illegal po.
FDA, if it is a compounded drug and it is prescribed by a doctor off-label, is it illegal or not?
Malinaw naman po yung sinabi ni DG na pag nag-prescribe po ang doktor na off-label, siyempre po maghahanap po ng authorized drug sa market. Meron po ang mga compounded pharmacy na pwede silang mag-compound.
So is it legal or not?
Legal po yun kung
Thank you. Thank you.
galing po sa legal na paraan.
Thank you.
Authorized po.
My next question, FDA. If it is a registered drug, nag-prescribe ang doktor, is it legal or not? Off-label.
Opo, off-label po.
Oh.
Pagdating po sa off-label, meron po kasi diyang
hindi, wag na tayo mag-ano dun sa qualification ng medical. Legal ba yun o hindi?
Pag pinescribe po ng doktor ng off-label, pag sinerve sa, kunyari sabi niyo na po, nandun na sa Mercury yung gamot, registered na po. Madi-dispense po yun kung meron pong prescription.
So is it legal or not?
Kasi po nga, yung practice of medicine, under po yan ng Board of Pharmacy.
No. Do not. Registered drug. Ginawa niyang off-label. Is it legal or not? Okay. Huwag tayo pumasok sa ivermectin ha.
Sandali lang po.
Pediatric drugs. Ang 20% dyan off-label. Now, is it legal or not? Yun lang naman tanong. Kasi ang dati yung stand dati, kasi hindi registered, illegal. So pag compounding, legal. So ngayon, off-label, is it legal or not? Under the law.
2 minutes.
Legal po siya.
Okay, legal. Okay. No, Dr. Late, hindi na kita tatanungin kasi mas malala pa yung posisyon nyo sa DOH. Mas malala pa yung posisyon nyo sa FDA. So what I'm saying here is, nagkaroon na po, nagsalita na po ang mga doktor, 553 of your doctors, nagkaroon na ng survey. Your doctors are saying, allow it to happen. Your doctors, nung nagkaroon po sila sa PASE na survey, they're already saying, payagan na to. Ngayon, ginigipit nyo yung mga doktor, ayaw nyo mag-prescribe. Kaya po, malaman ito ng sambayan ng Pilipino. Kunyari, pinapakita, registered, kunyari ganito, pero ginigipit ng PMA, ng PCP, sa DOH, ang mga doktor. May kaso po ngayon yan. No less than the Department of Health called the Philippine Regulatory Commission para tanggalan ng lisensya yung 4 na doktor. The 4 doctors who were na minensyon ng presidente willing to put their heads no, to the chopping board para ipakita ang katama ng ivermectin. Yan po yung binabanggit ni Presidente Duterte. So thank you, Mr. Chairman. Maraming salamat po.
Congressman.
No,
Mr.
Dr.
Congressman.
Olarte, hindi mo sinasagot. Yung talo ka pa ng DOHFD. Parang mas malala pa yung policy mo eh.
Hindi po, no? Ang
Kaya,
sinasabi
no, I just want to make it clear. Dr. Olarte, kasi for the record po tayo. FDA already said for the record, pagka-compounding, it is legal. FDA already said on the record, pagka-registered off-label, it is legal. Quoted po yung mga video ng DOH at FDA. Pinakita ko na po kanina kung di nyo napakinggan. So thank you, Mr. Chairman.
Thank you.